Hello, I'm Amanda, and I'm the Communications Manager at the IOCDF. I'm so thrilled to be here for another IOCDF interview. I'm joined today by Ogechi, Cynthia, Onyeka. Thank you so much for being here with me, Doctor.
Thank you so much for having me.
I'm so thrilled to have you. If you don't mind, would you just introduce yourself for our audience, please?
Yeah, absolutely. So my name is Dr. Ogechi Cynthia Onyeka, and I am an assistant professor in the Department of Psychiatry and Behavioral Sciences at Baylor College of Medicine in Houston.
Perfect. Thank you for that. So, how did you first become interested in studying OCD?
Yeah, interestingly enough, I was familiarized with OCD through my postdoc work here at Baylor College of Medicine. I came from a background of trauma and anxiety, internalizing symptoms, so I had a lot of exposure with exposure therapy. But through my postdoc work, I found a huge love for OCD and just how effective ERP can be with this patient population. And I've been in love with it ever since.
Amazing. What inspired your research?
Yeah, so my research interest is definitely informed by my graduate work with community violence exposure and trauma, by understanding what are the risk and protective factors that impact treatment course and symptom presentation for folks exposed to trauma, and extending that to folks with internalizing symptom presentations, including OCD, and understanding how different risks, sociocultural factors, and protective factors impact symptom presentation and outcomes with OCD as well, particularly among minoritized populations.
And what are you hoping to achieve with this research?
One of the greatest things I hope to achieve through this research is increasing our understanding of what OCD looks like across these underrepresented populations, how symptom expression and presentation may either look differently or the same just based on different sociocultural influences, and how we can use methodologies like community-based participatory research approaches to make sure that we're able to understand these different either perspectives, experiences, from a culturally nuanced perspective to make sure that we increase ecological validity for all groups.
How important is it to focus on these underrepresented communities?
I think a lot, especially in our day and age. Unfortunately, a lot of the research historically has been done with majority group populations. And while we've definitely had a huge amount of research generated and a wide evidence base on symptom presentation of OCD expression, how it might look across related disorders, unfortunately, those findings may not generalize to all different groups of people, just on the virtue of them being done with majority Caucasian groups, majority groups in general. So by increasing the participant pool to minoritized and traditionally underrepresented groups in this research, the findings that we do have can be more generalized to folks across the board and not just in one majority population.
That's so helpful. And you touched upon this, but those populations might face different challenges.
Absolutely, especially when we think about the different sociocultural systems that we're all involved in. We don't exist in a silo. We're influenced by not only like our inner systems when it comes to like family and social circles and school and these micro systems, but also larger macro systems that are impacted by systemic influences, whether it's political, socioeconomic, what have you, and all of those can impact how we experience the world, our well-being, and when it comes to like mental health and OCD, how we experience that as well. So it's very important to use that as a tool to examine these experiences and symptom presentations so that we have a very clear understanding of what it looks like for all folks rather.
Yeah, that's critical. I would love to hear about the BLOC project. Could you explain the acronym and just tell us a little bit about it? I know it's a very complex undertaking, so I know it's not a simple answer, but I'd love to hear more about it.
Yeah, absolutely. I'm really grateful to have been awarded an award through the International OCD Foundation called the BLOC Project, or the Black and Living with OCD Project. And what the project is a mixed method study looking at the lived experiences of Black Americans with OCD to understand some of the factors that I mentioned earlier, like symptom presentation and expression within this population, which is historically underrepresented when it comes to OCD research. And not only those folks, but also folks who are within that population that have family members with OCD or who might suspect that their family members have OCD, and then also the clinicians that treat them. And through qualitative inquiry, through focus groups, understanding what OCD looks like in this community, what different sociocultural factors are coming into play, whether it be stigma or like things that regard to access to treatment, and how we can make sure that OCD research better benefits the Black community. Then using the themes from those focus groups to generate a psychoeducational online web program to help increase treatment access and engagement for Black folks with OCD. So it is, like you mentioned, a quite ambitious study, but I'm really excited to be a part of it and to see what we find.
Amazing. What role does community-based research play in the study?
A very big role, a very big role. What's, again, like I mentioned, one of the really important aspects of my program of research using these methods, particularly by way of convening a community advisory board. So these are stakeholders who either have lived experiences with OCD and they're also in the Black community, or work with individuals who have OCD or may have family members with OCD to help inform, like, what are the questions we're asking in these focus groups? What are some of the topics that we should make sure to include on the website? What are some of the ways that we can connect with the larger community to share more information and psychoeducation about OCD and like different opportunities for treatment? So prior to even starting the project, I was able to meet with our community advisory board, ask some of these questions. And now that we're undergoing the focus groups, once we have a good amount of focus groups completed, the initial data that we get from those focus groups will again be run by the community advisory board to get feedback on what are some of the codes that we should use to help code some of these focus groups and thematic analyses. And then once we create the website that we'll test for feasibility in terms of increasing treatment access and engagement for OCD with folks in the Black community, what should this website look like? So just getting feedback from folks who are stakeholders at every stage of the research process.
Wow. How did you learn about the Jenike Young Investigator Award?
Well, I learned about it from a newsletter that I got in my inbox from the IOCDF, and I was really excited that it was an opportunity that I could partake in. And then also my mentor, Dr. Eric Storch, also shared information regarding the award with me and was really integral in helping me prepare my application as well. So I was really excited that I had this opportunity and I knew that it was happening.
Amazing. Well, we're so excited you heard about it. We're really thrilled to have you be a part of the program.
Thank you, likewise.
Well, it's been such a pleasure chatting with you. Before we go, I just wanted to ask you one last question. It's kind of a trick question, but I swear you'll like it. Is there anything I haven't asked you that you think is important to point out, or anything that you would be remiss if you didn't mention while we're chatting?
That is a great question. I think and I guess I kind of related to it a little bit earlier, but just the importance of using community-based research approaches. And that doesn't only involve research, also when it comes to increasing treatment access, just involving the community in this work, especially since, at least from what I've known anecdotally, I've come into the OCD world fairly recently. A lot of people don't know about OCD in terms of what it looks like who experiences it, what happens when you do, present with symptoms, and how you can get treatment and care. And engaging the community can be really, really helpful in just sharing this critical information, because there are a lot of folks who present with the symptoms but have not, been either diagnosed or even aware of those symptoms and, qualify them as OCD or even think that there are treatment options available. So just the importance of engaging with the community to be able to share that information and understanding what folks in the community need when it comes to receiving it.
Yeah, that's so critical. All right. Well, thank you so much. I really appreciate you taking the time to join us today.
Thank you so much for your time.